Good evening. We'd like to welcome you to this live stream event on Facebook Live and on YouTube Live. We are coming together this evening from Urban Light Community Church, but there are people from many organizations and walks of life here this evening to discuss facts about the COVID-19 pandemic, as well as a moderated panel by Watasha Barnes-Griffin with leaders in the African American community about vaccinations and concerns in minority healthcare. We also this evening are honored to have Dr. Jeff Bird with us, as well as Pastor Maria Wilson, who heads the healthcare subcommittee for the Mobilizing Muncie group. I'm Pastor Andrew Draper, and we want to welcome you this evening. If you are on Facebook or on YouTube tonight, you are welcome to comment in the chat thread on either platform, and I will be able to see those comments. In a short amount of time here, the moderated panel by Watasha Griffin will be accepting questions. And so you can comment even starting now. Anytime between now and the end of this event, you can comment in the panel, and we will collate and curate those questions and submit them to the panel as time allows. It is very fitting that we should be joining together this evening at about a year after many of us in the community joined together to begin work on systemic racial justice issues, especially in the light of the killing of George Floyd. And we know today that a verdict has been reached, and while we are thankful for that, we know that there is much work to be done. So we can be thankful for justice while recognizing that we have a long way to go. And so we are glad this evening to be discussing together issues that are of benefit to our community. And the reason we are discussing these in a church actually is because we believe that God has called us to love the whole person and our whole community. And so each of us who is here this evening come from different walks of life and different organizations, but we desire to work together for the well-being of our community. So we thank you for joining us. I'm going to open us in prayer, and then without further ado, I'm going to pass it over to Pastor Maria Wilson, who will then lead us through the rest of this evening's events. So would you join me in prayer this evening? Gracious God, creator of heaven and earth, we thank you that you formed our bodies. The scriptures say in the Psalms that you knit us together in our mother's wombs, that we are fearfully and wonderfully made. And so we recognize that you are the God who created us, and you breathed the breath of life into our very beings. And so because of that, we want to take care of the bodies that you have given us. And we want to work for equality and access in healthcare. And we want to work for justice in all aspects of life. We give you glory tonight, Lord God. In the name of Jesus we pray. Amen. We are thankful also for IU Health and Open Door and Meridian partnering with this event and this work in the community this evening. And I'd like to introduce Pastor Maria Wilson, who is the chair of the Mobilizing Muncie Health Subcommittee, who will guide us from here. Thank you.
I'd like to thank everybody for joining us tonight. One thing that I want to say about the next presenter is that I have a lot of respect for him, and I will tell you why. The very first time that the subcommittee had met, one of the things that I said is, I know we can't fix everything, but I just want all people to feel safe in a time of health crisis, that they can feel like people care about them and they are getting the best possible care in the city of Muncie. And he said, I want that too. And I really believed him at that time, and I still believe him every time he comes to the table and he says, what are we going to do about this? And so when he says we, that includes me too. And so whether you know it or not, that's a wonderful start in our community. So without further ado, I'm going to introduce you. It is my privilege to introduce you to Dr. Jeff Bird, who is the president of IU Ball Hospital. Thank you.
Thank you, Maria, and it is indeed an honor, but mostly a blessing for me to be with you tonight. Hopefully, I'm going to share some information with you about COVID and about the COVID vaccination. But first, I think I would be remiss not to recognize and thank Pastor Maria. It has been an incredible opportunity for me to serve you all with her in the Mobilizing Muncie Health Subcommittee. And again, I'm honored and blessed to be part of that effort. Goodness knows we've got a long way to go, but we have to start somewhere, and I feel really good about where we are and where we're going. So Pastor Maria, thank you for your leadership. I appreciate all that you've done so far. So I've got a few slides I'm going to work through that I think you'll all be able to see on the PowerPoint. So if we can throw that first one up. Okay. So what are some facts that I want to tell you about the COVID vaccine and the COVID virus? It's here, and it's still here all day, every day. My team at Ball Hospital is dealing with it every day. From last March, when we had our first patient who was admitted to Ball Hospital with a COVID-19 diagnosis, through the huge surge we had in the late fall and winter, November, December, and January. And then we got a little bit of a reprieve, actually, in March. Many days at Ball Hospital, at our highest, we had about 90 patients in our hospital who were being cared for a diagnosis of COVID. Many of them required intensive care, and many of them required a breathing machine, a ventilator, for them to breathe because they were not able to breathe on their own. So this disease is real. We had a little reprieve in March and the first part of April. We just kind of steadily went down. Certainly, I would like to pass on to the viewers and listeners that we're certain that our ability to start vaccinating, which we did in December, was a pivotal point in us helping to start decreasing the number of COVID infections that we were seeing in our community. The truth is, we still have a long way to go. So we have noticed even in the last 6 or 7 days, we got down to where most days we had fewer than 10 people with COVID diagnoses at Ball Hospital. And many days we did not have a single patient in intensive care. And over the last week, we've unfortunately seen a resurge. This morning, we had 21 patients with COVID hospitalized at Ball Hospital, 8 of them requiring intensive care, and 5 of them back on a breathing machine. And you can imagine the toll that's taking on my team, my doctors and my nurses, my respiratory therapists, because I think they finally hoped that we had gotten over the hump, and this new surge has been very emotionally, taking a great emotional toll on them. I want to talk a little bit about variants because we think the variants are part of the reason that we're seeing this little surge across many states, and we've seen it here in East Central Indiana. In the United States, we do now have at least 2 and probably more variants. You've read about them in the paper. The difference between the initial COVID virus and these new variants is these variants tend to be more infectious. Now, what does that mean? That means if we get exposed to them in the routine of our lives, it's more likely that they're going to cause an infection in our bodies. And this is what viruses do. It's how viruses survive. So we knew this was going to happen. It appears that the new viruses are certainly more infectious, but they also probably cause a worse disease, a more severe disease. All the more reason for us to consider why we might want to think about getting a COVID vaccination if you have yet to do that. So could I have the next slide, please? So I know during the panel time they're going to express some of these things, but I want to acknowledge that I think it was very reasonable for people to wonder about this virus and this vaccine. I think it's really important for us to recognize that and to acknowledge that. I've heard all the questions out there. I've been asked them. And, you know, it is the truth. This vaccine came to market under a very special rule called an emergency use authorization. In medicine, we call that an EUA. Now, what does that mean? That means that our government, through the CDC and the FDA, much more rapidly than usual, looked at the facts and made a determination that the vaccine was safe. And I think there were a lot of people that were confused by how it happened so quickly, and I think there were a lot of people that raised a lot of questions in their mind. And I want to acknowledge that because I understand that. I think it's important for all of you to understand that the technology that went into making particularly the Pfizer vaccine and the Moderna vaccine has been studied for decades, and it has been ready to go when it was needed. So that, I hope, is somewhat reassuring to you. So it is true that it was a pretty rapid course of events that got us ready for this. And I know there were questions about, was it adequately studied? Was it adequately studied in people like me with my particular health circumstances, or my race, or my ethnicity, or my age, my other health conditions? And I think that what we can clearly say today is after hundreds of millions of vaccines across the world, and 132 million vaccinations in the United States, that in my medical mind, I want you to know that I think this is one of the safest and one of the most effective vaccines that humans have ever invented. So that's a really, really important point that I want you to understand. This concept on the slide called herd immunity, what does that mean? That means that I think we all hope, don't we, and many of us pray that at someday we're going to get back to normal and that this COVID virus will go away like smallpox did and like polio has pretty much done in the United States. And to reach this concept of herd immunity, experts vary, but we probably need somewhere in the 70 to 80% of all Americans vaccinated for COVID for herd immunity to take over. I was just reading an article by Dr. Anthony Fauci, who has kind of been the spokesperson in the United States around COVID today, and his recommendation is that we quit talking about herd immunity, because what we really need to be talking about is people getting vaccinated. So every person that gets vaccinated protects them, protects their family, protects their neighbor, and protects their coworkers. So can we move to the next slide, please? Oh, goodness, okay. Yeah, so this one's hard to see, and I know it is. This gives you an idea of what my vaccination clinic at IU Health Ball has done. I'm very proud of the team. Those of you who may have been there to get vaccinated, I am one of you. I got mine after all my frontline workers did, kind of mid-January or so. And we hope this week to pass 40,000 shots given at IU Health Ball Hospital. So we're very proud of that. And I'm also very proud of the work that Meridian has done, the work that Open Door has done, the work that the Delaware County Board of Health has done. It takes all of us pitching in to get where we want to be so that we can give everybody opportunities to get the vaccine. Next slide, please. So how's the supply going? That's in the news a lot, right? And I want to assure you that the vaccine supply is strong. I don't foresee at Ball Hospital, or I don't foresee at the other places that are giving vaccinations now, that we're going to have any problem having enough vaccines to go around for everybody who wants to get vaccinated. And I'm still confident that by the end of May, certainly by the end of June, if we had willing people in Delaware County, we would be able to get almost everybody vaccinated. So don't worry about the vaccine supply. We've got enough. Are there new vaccines on the horizon? I actually did this slide for a presentation at Muncie Rotary, and there probably will be new vaccines that come on. I think the more important point for us to talk about tonight is what the heck went on with that J&J vaccine. So I want to give you the facts about that. You've read in the paper, you've heard on the news that there was a temporary withdrawal of the J&J vaccine, and I always forget the terminology, due to an overabundance of caution, I think is what they say. There were 6 or 7 women between the age of 18 and 45 who developed a very serious condition with a blood clot in or around the brain. What I want you to understand is that there have been 0 blood clots, 0 from the Moderna or the Pfizer vaccination. And if you look at the number of women in that age group, that's a normal thing that can happen. The incidence, that is the number of times this happened in women who had gotten the J&J vaccine, appears to be exactly the incidence that women would get that whether they had the vaccine or not. So I hope that's reassuring to you. If you took the J&J vaccine, watch for symptoms, but I don't believe you're going to be at any greater risk. It looks like the first couple weeks are when you need to think about this. And I've had a lot of people ask me, if J&J comes back and it's available, would you get one? And I tell them, yes, I would get one. I think if you've got a history of blood clots, that would probably be a reason that you would want to choose the Pfizer or the Moderna vaccine. When we think about who's eligible for the shot, just a couple weeks ago, we've opened it up to all adults, and then we got it down to 16 to 18-year-olds. I keep reading in the medical literature that we think sometime fairly soon, probably in the next couple months, we'll get the age down that 12-year-olds and above will be eligible for the vaccine. I try to work in our vaccine clinic at Ball at least once or twice a week because it brings me great joy to see how happy people are who come to get the vaccine. And I worked last Friday morning, and it was pretty surprising to me how many 16 to 18-year-olds we had coming to get the vaccine. So I was very, very happy about that. Next slide. So I guess it's question time, but let me at least leave you with this. I want to emphasize again that I understand why you'd be reticent to get the vaccine. But I think now we've been in it for 4 months. Millions and millions and millions of people have successfully gotten the vaccine of all races, all types, all genders, all ethnicities, all kinds of medical problems, and I want to emphasize that I believe the medical literature supports this to be one of the safest and most effective vaccines that has ever been put to market. So I think I'll stop there, and I'll be more than happy. I'm hanging around, obviously, and I'll be here to answer any of your questions as the program moves on. So thank you. Oh, yeah, we do have another slide here. So thank you, Pastor Maria, for reminding that. So I want you to know that we do at IU Health Ball offer the Pfizer vaccine, and we have it at 2 places in our South Tower. That's our big clinic, very easy to get in and out. We've gotten a few people in and out in less than 20 minutes. So you can get there very, very efficiently. The same thing has never changed. If you're thinking about getting a shot now, go to ourshot.in.gov, or you can simply call 211 and they will help you get an appointment. All of the vaccines are still by appointment, at least now. We hope to have some mass vaccination opportunities coming soon to our community, but more information about that later. So thank you. Thank you for the reminder.
At this time, Watasha Barnes-Griffin is going to come. I failed to mention her role and title earlier. She is the CEO of the YWCA here in Delaware County and is also directing the Muncie chapter of the Indiana Black Expo, which is also partnering with this event this evening. So we want to thank them so much, and we want to invite Watasha Barnes-Griffin to take it from here.
Thank you, Pastor Draper, and thank you, Dr. Bird, for your presentation. I really appreciate your open and honesty with how you presented at Rotary. It really made me say, hey, I want him to kind of do that for us. And for me, during the Rotary presentation, it was very detailed, and you gave some significant data. And so I think that was one of the motivating factors for me to be vaccinated. So thank you. But tonight we are definitely here to have this conversation with our community about vaccinations, to vaccinate or not to vaccinate. I know that that is the topic in the Black and brown community. And so tonight we have leaders with us who are going to kind of help us address those concerns, answer questions, share their story, their vaccination story, and then also engage with you on the virtual platform. And so as African-American leaders, we have an obligation to not just lead and just talk, but to actually lead by example. And so we need to be accountable to our community. We need to be transparent with our community. And we have to come and we have to speak to the fears and the reservations of our community, as well as help to educate. And so that's what we're going to do tonight. And so I'm privileged and proud to be able to have these folks with us on the platform. And so I will share their names, and then I'll give them each a minute to kind of tell you who they are and what they do. And we'll start here with Todd Mason, who is a longtime out-Munsonian, born and raised, and an activist in our community. And so we'll let Todd kind of share about himself, and then we'll go on down the row, and then we'll end with Pastor Andre Mitchell. So we'll ask that you grab one of the mics there, and as you, there's 2 here, and as you transfer, there are sanitary wipes there if you want to use them, but we'll just give you about a minute just to kind of talk about who you are and what brought you here tonight to this platform.
Good afternoon. I'm Todd Mason, of course. You just said that.
It's all good.
I'm a longtime resident of Muncie that's been a lot of other places, but I'm now living in Fishers, Indiana. My reason for being here today was my best friend's wife asked me to speak, and Anitra did, and I said, sure. I also know that my Aunt Rosemary was a longtime member of this church before she passed, and this place means a lot to her, so once I heard it was here at Urban Light, I had to jump on it. My reason for taking the vaccine. Well, I travel a lot, and I don't want to stop traveling unless I have to, unless they shut it down, but I like to travel. And I also have 2 small children that I love dearly, and I didn't want to put them in harm's way for me being out and about as much as I am. I visit around a lot. Of course, y'all see that on Facebook. I love to visit my friends, my family, and I also work for the government, so I have a little inside scoop on how I know the transparency of the safety of the drug, and I know that the CDC is a separate entity. It's not politically motivated by, money and other things like a lot of people think, but I know that I trust science. So that's my reason for getting the vaccine to make sure that I don't put people that I love in harm's way. So that's why I'm here.
Thank you, Todd.
And I took the Moderna.
You took the Moderna.
I had burning on my arm for a few days, and in the second shot, I had cold chills the first night for about 3 hours, and nothing since.
How did you feel walking into whatever clinic you went into? That just the
Well, I go to the VA. I'm a disabled vet. I feel uneasy going to the VA for a lot of reasons, but going for the vaccination, they have a lot of safety measures in place now. It's really like a ghost town out there. So you don't really, everything's like push you through. It looks like this here. It's kind of like walk down this hall, go take a shot, go sit in the other room by yourself for 15 minutes, and then you can leave. I didn't feel any need for fear. And I know that we as a minority community, we have a lot of doubts about our medical system. A lot of it being that we don't have a lot of access to it, and we need more of that. So I tell people that, I tell people that COVID is not attacking black people more. It's just that we aren't as privy to healthcare as others. So that's the main reason. So people are people. But if you don't have access to health care, you can get sick a lot easier. So I'm blessed to have health care, and I'm going to use it. So I want to protect my children and my family.
That is one of the topics, and one of the things that we've heard over the past year is not just with COVID, but the African American community tends to kind of lack in routine health care and making sure that, we visit doctors and have that routine health care, but that also goes along with the mistrust that we have in our community. And so this is an opportunity, again, for us to educate and share our stories, and not just with COVID as we move through the COVID pandemic, but to be more up on and be more willing to take care of our health in general. And so thank you for being here, and we will come back to you again. And so now we'll go to Theresa Long. I will say that Minister Theresa Long is a LMSW. She is the owner and operator of Grace Beauty College, and she is here with us tonight. And so we thank you for being here. She'll just kind of take a minute to kind of tell you a little bit about her COVID journey, how it's affected her and her family, and keep it to about a minute or two, and then we'll come back to you. So thank you.
Hi, yes. Like she said, Theresa Long, have a master's degree in social work, along with I've had beauty school been doing hair for over 28 years, and I decided to go back to school because just kind of sitting in the chair, listening to a lot of problems and issues that my clients went through, I was like, I might need to go get another degree. And so I did that. And so we have actually launched our new mental health clinic. It's called Hope Chest-Tacoma Center. And so we're really excited about that. My experience with COVID, I've had family members pass away from COVID. I have decided at this time not to be vaccinated because there are a lot of questions, like Dr. Bird mentioned. I have a lot of questions I've asked. I've been on several community forums online. I've asked questions, and those questions have not been answered. Because of my degree, there is specific trainings concerning statistics and trials and, level 1, level 2, level 3, level 4 clinical trials and placebo trials and control groups and all those things. And because of the lack of transparency, and I just want answers. I have had family members die from COVID. I know COVID is real. There are other things that are out there that individuals can take according to, the different medical journals that I've read. And so when I ask questions, I don't get answers. And it makes me leery. I had a cousin that passed away from COVID, and I'm sure if she was in Ball, I'm sure Ball did what they needed to do to help her. But there were some stipulations around her passing. She was put on a ventilator, and for 12 hours, nobody in our family knew. And so that perpetuated the distrust, for me and for a lot of people in my family. And so we're asking these questions, and nobody will answer. And all we want is answers to the questions, and we're not getting it. And so that's why at this time, some of my family members have gotten it. I am not anti-vaccination. I believe in freedom to choose. So if you want to get it, and I'm going to support your decision in getting it, but I still have questions. So that's where I am today.
So thank you. And so we hope that with Dr. Byrd being here on the panel with us, that he can answer some of those specific questions. And so if you, audience and viewers, have questions and concerns and your fears, this is a time to send those questions in, because we want to have that discussion. We don't want to take this time for you to watch and then walk away with no additional knowledge, right? We want you to have all of that. And so here is the time to get that information and get those questions. And if Dr. Byrd doesn't have the answer today, I know 100% that he will go and research that, and he will circle back to Pastor Maria and make sure that we can answer those questions for you. So please send those questions in. And so thank you, Dr. Woodrow Elliott, elder of True Vine Holiness Tabernacle. We thank you for being here, longtime community member of Muncie Black Expo Board of Directors, and all the other things. We thank you for being here tonight, and just want to kind of give you a minute to share your vaccination COVID journey and what made you decide to vaccinate.
Well, good evening, and thank you for having me today. Yes, COVID, was unexpected, and there were a lot of questions out there. Didn't nobody really know what was going on, and we heard new information every day. So we had the lockdown, and everybody wanted to get back out again. So when we got back to work, I was nervous, still not knowing a lot of stuff going on. And the job I hold, I work at General Motors, and the job I hold, I deal with a lot of people. And then outside of work, in ministry, I deal with a lot of people. So that gives me apprehension on going a lot of places. And then myself and my son, we both suffer from asthma. So when I seen the vaccine and I started reading up on it, I looked at it as something that, okay, since I'm dealing with so many different people, this is something that I want to look into. And then as being the head of my household, I felt like if anybody was going to get it, I need to be the first one to get it. So I got the Moderna. I got it. First shot, everything fine. Second shot, first day, everything fine. Second day, started to get the chills. I started to get chills at work. Got home, took some cold medicine, laid down for maybe 2 hours, got up, no problem since. So that's the reason why I got it. And also, I got family members that I really can't go see. I got family in Louisville that I really can't go visit because of COVID. So I'm kind of hoping and praying that we can get past this so we can get back to the time that we can spend time with our families and go to gatherings and have family reunions and stuff. So we're not just gathering for sad events like funerals or something, but we can celebrate life together, and get past all of this stuff that we're going through right now.
Thank you, Dr. Elliott. We also have with us tonight District 6 Councilwoman Anitra Davis. And so thank you for being here. Thank you for taking time out of your busy schedule and calendar to be here to represent for your community. And so we count it a privilege and an honor to have you with us. And so if you could just share your pandemic story and your decision to or not to be vaccinated, I'd appreciate it.
it was a big decision because my husband and I, we decided that we were going to wait. We were the ones that said, we're going to wait and see how many people get this, see how they do, see what happens, and then we may get vaccinated. So we had some conversations. We started doing a little research with information that's out there. We listened to others. We listened to, I was on not on a panel, but I was in a Zoom meeting. I think Dr. Bird was on there, and he was explaining, he was being completely honest about everything, just laying it all out. And after we did more research, and we thought about how many people died. That was one of the biggest things. You know, there were thousands of people that died. And that's just a scary thought in itself. This is not normal. This is not something that we've ever lived through. This is different. Everything felt different. Sure, we've been vaccinated with, you know, going to school. You know, we got our vaccination, so we thought about that. You know, we lived through. We never got a smallpox or, you know, those things. So you think about, you know, all the things previous. So we had a lot of different conversations. We went back and forth. But one day, my husband, his profession is going into other people's homes. And he went into somebody's home that didn't believe in wearing masks. And it's their home, so it's their choice. He had his mask on, but the gentleman was sick. And he didn't tell anybody that he was sick. And then my husband was like, I could have brought that home to you. He was scared. Like, he was like, what if you get sick and die? We've been married 23 years, and I don't want that. I don't want to live here without you. And it was a big deal. So we talked about it again and just said, you know, we want to travel. I want to see my grandmother every Sunday. She's in her late 80s. You know, I was fearful of going to her home. So many emotions. It was a roller coaster. We didn't immediately say, we're going to go get the vaccine. So many things happened through the months to say, yeah, we're going to go ahead and get it. I think this is the decision for us. I'm not going to push it on anyone else. Everyone has to make their own decision. But we want it to be safe. We want to travel. We want to see our family. We want to be safe for one another. So that's why we got the vaccine. Both my husband and I got the vaccine together.
Did you go together?
We did.
For both?
For both.
Oh, that's so
yeah,
cute.
Yeah. So we're fully vaccinated. And he didn't get any symptoms. I got the COVID arm. So my arm was swollen from the first shot. The second shot, I was okay for the first 24 hours. Then after that, I was exhausted. Just really, my body was just tired. And I was a little achy, but after I got through that, I took a few naps, which I needed anyway, and I was better, and I feel good. So, and I'm happy to be vaccinated, really, because I feel like I'm not going to harm anyone, hopefully, and they can't harm me. So,
thank you. Pastor Andre Mitchell with Deliverance Temple and all of the other things, Collective Coalition of Concerned Clergy, and all of the work that you do with Mobilizing Muncie and just for our community in general. So thank you for being here tonight. I know that two of these gentlemen, elders and pastor, work for General Motors, and they have to go to work tonight when they leave here. So we thank them, right, for being here with us tonight. And so we'll give you a few minutes to talk about your pandemic and COVID journey. And again, thank you.
Pastor Andre Mitchell here, and yes, this has been quite a journey, and as a pastor, it was very difficult emotionally to see all the people going through things, and I dealt with a lot of death. Not all of it was COVID related, but oftentimes my church is asked to host funerals, and so seeing people burying their loved ones and not having a lot of people be able to be there to help bury them, that was hard. And then just talking to pastors around the country and the many people who were burying people, it shifted the way I thought about things in general. And so every decision I made for my church was with the idea that how would I feel if I had an outbreak at my church, and things were traced back through contact tracing, things were traced back to me. And I just started making a lot of decisions based on, I just don't want anything to happen, because our church in general and pastors in general, we're trying to help people. So I don't want to be the cause of hurting people. So that made me think different about a lot of things. Also, my 20th wedding anniversary vow renewal ceremony got canceled because of COVID. I was supposed to be in Paris. All of that got canceled because of COVID. So there was just a lot of loss, not just life, but just a lot of things were lost. So when it comes to the vaccination specifically, normally I'm a person who is not against vaccinations at all, but I normally don't get a flu shot. I hadn't had a flu shot in 15 years. It just worked better for me, and I hadn't had the flu. So never been against vaccinations, but since I wasn't a person who got a flu shot, getting a COVID shot just wasn't something I was thinking about doing. However, I started thinking from the fact that I was thinking of vaccinations only from the fact of me personally. But as a leader, I thought, I've got to think differently. And so far, we didn't have any issues with any COVID outbreaks at my church. But I thought maybe I should step up just for the simple fact of wanting to be a leader and be an example. So the first thing in December, we had a flu vaccination site at my church where people were able to get their flu vaccinations, and I decided to get the flu vaccination on that day because I wanted to be an example and I wanted to be a leader, and I hadn't had one in 15 years, and so I went ahead and got the flu vaccination. And then a couple months later, I got to thinking, I think I need to step up and do the same thing again. Me and my wife talked about it, and she got the Pfizer vaccination. And I was waiting on the Johnson & Johnson because I felt like many of my people, I lead basically African-American people, many of them have a name recognition with Johnson & Johnson, and the idea that it was only a one shot. I thought a lot of my people would want that one. So I decided to get it, and I got a chance to get it here at Urban Light. They had a vaccination site, and they were offering the Johnson & Johnson shot. And so I decided to do it because I was thinking, when people asked me, hey, what do you think about getting it? How did it affect you? I didn't want to just talk about things I studied, things I researched. I wanted to talk about something I knew personally from my personal experience. And so from my personal experience, I had absolutely no symptoms at all. I had a slight headache after the Johnson & Johnson shot, but I hadn't eaten all day. So I ate, took an ibuprofen, and I was perfectly fine. And then it just so happened that a lot of my members end up hearing about the vaccination site here, and a lot of them got vaccinated here as well. And we've had people who've got the same thing, got the Pfizer shot at Ball Hospital. So just leading by example, stepping out there and saying, if you're a leader, sometimes you just have to take that chance and put yourself out there to see how it affects you and be able to speak from experience. I don't want to speak from speculation. I wanted to speak from experience, and from experience, both me and my wife have had the vaccine, different vaccines, and we both are doing well, and many of my members are having the same scenario where they are benefiting from the vaccine. We do have some members who do not want to take it, and we are not pressuring people. We are encouraging people to make a educated decision, and for me, the educated decision was to be an example. So that's why I did what I did, and I don't regret it at all. I'll also add, even after hearing about the Johnson & Johnson pause, that was a few days probably after I had reached my 8th or 9th day, I still didn't regret it at all. I still feel like, as a leader and leading by example, it was important for me to do it, and I would do it all over again. And I would still get the Johnson & Johnson like I did the first time.
Thank you. So I'll have to share my story just a little bit. I mean, most people that know me or follow me on social media, they can see that I kind of talked about it on social media, had it in the paper and things like that. But I was like the #1 antagonist. I am not getting no COVID vaccination. I was adamant at every meeting that I would go to with medical professionals, Dr. Bird, Brian Ayer, the Open Door. I'm like, I ain't getting that shot at all. And like Pastor Andre said, I'm like, I run an organization that serves vulnerable populations, right? So women and children who are homeless and come to us in need and need a place to be, and our staff take care of them and support them. And how can me as a leader of not just YW, but as a community leader, like not stand up and lead, you know, in this way? And so as scared as I was and not really 100% sure that I believed everything that I read or all of that, I just knew that I needed to make a decision to be vaccinated for myself, for my staff, for my residents, and for our community, right? And so scared and shaken, I listened to Dr. Byrd at a Rotary presentation, and he was so thorough. And I was able to pick up the phone and call a couple of people, Brian, and ask a lot of questions. And they relieved some of those fears. And one of the things that pushed me was that during the shutdown, you don't get to shut down an emergency shelter. You don't get to shut down a homeless shelter. You don't get to do that. And they come to us in regular times, but when the COVID pandemic was happening, they were coming in droves. And so here I am exposed to them, they're exposed to us. And so it was like, well, Tasha, you have to lead. And so then I decided to just kind of share it on social media and for people to be able to reach out and ask me the questions. But the moment I scheduled to take the vaccine, I did it really early, like right at the top of February, because I fought to be an essential worker. I'm like, look, we're not in that list, but we are in the face of folks every single day. People with meds, they need meds, or we don't know where they're coming from. Like, we need to be protected. And so I was able to go ahead and sign up and register to get the Moderna shot. And I went to Open Door Health Services. And the minute I walked in the door, it was easy to get on and register. Walked in the door, they guided me right down to the vaccination site. They had a camera with them, and they're like, oh, she's brave. She done had kids. I'm like, I don't care. I have had 2 kids, but I'm still scared to get this vaccination, like, really, because I just don't know. And I think I'm a pretty intelligent person, but I still have some mistrust when it comes to what's medical and what's going on in my body, and is this the right thing for me? And so, yeah, scared and shaken, I sat down and I got that first shot. And I sat for 15 minutes, and I didn't have anything from shot 1. When I scheduled for shot 2, went in, and everybody's saying you might be sick, and a couple of my staff members were already scheduled to take off work because they thought they were going to be sick, and I'm like, you even got the second dose. But I didn't have any effects at all. But what I did both times, for transparency, my husband has not been vaccinated, and he's very willing for me to share that. But I said, every 15 minutes, wake me up, because I was scared that, I might not wake up. And I'm like, well, if I don't wake up, then that might tell some people in my community not to get the vaccine. But if I wake up and I'm healthy and vibrant, I'm going to say, go get the vaccine, because I don't want to continue to walk around with masks. I want to get back to living. I want to go to work and not fret that every person that I encounter is going to transmit this disease, this virus. I'm just ready to live. And so that is my story. And again, there are maybe 80% of my staff who, they're still in that decision-making process, but our residents, we offer them the opportunity to be vaccinated, and we just continue to educate and make that available, and eventually and hopefully some of them will take us up on that offer. But tonight we are here to continue to ask these questions and to answer the questions and help you all to make an educated decision. And so one of the questions from the virtual audience is that they want to know from the panel, what would you like to see from our local healthcare organizations to help support our community during the pandemic and beyond? So what is it that you want to see from our local health organizations that you've not seen yet? And any of you can start with a response. Let's get that mic so we can hear you. We want them to hear you.
We are in a tough situation because we live in a country that has its freedoms. We have people who can make choices this way or that way or what have you, which is good. But it's not good with the pandemic. So this is going to be tough for this country to get over this virus. And it's not going to be within, in my opinion, a year or 2 from now. It's going to be at least 4 to 5 years, in my opinion. And that's because of social media, the fake news that gets pushed through social media, and it's believable. A lot of the information that's false that goes through social media, it looks professional. So you have a lot of confusion, and you got a lot of people who don't have the wherewithal to search the source of the information. So you got a lot of confusion. So there's a lot that our local medical facilities can do, but it takes the people to initiate it. And if they have a lot of misinformation, you're going to continue this cycle of spikes up and down, because each state has its own governing. There's different rules in each state. You got planes going from this state that has lockdown to a state that has lax laws. So you're going to continue to have this, and it's going to go on for a long time. You got people leaving the country, like myself. I go out of the country a lot. I work in a facility that houses not houses, but there's 4,500. It's the second largest government facility in the country. So, and you got a lot of people within that building that has their own beliefs, and that's just one example of many on how we're going to have this problem for a long time, because we have our freedoms. It's that simple.
Thank you. Theresa Long, so a question's coming through, and it says, is there a way that Theresa Long can ask Dr. Byrd one question that he could give some feedback on?
Yes. Well, I have many, but
Is there one? Start with one.
I'll ask one. I want to ask about there is something going around concerning antibody dependency. And so I frequent the CDC website, like I'm on there. And so I'm looking at, I think Todd or Woody mentioned getting back to normal. But on the CDC website, there's couple discrepancies. It's like, okay, if you're fully vaccinated, you can take off your mask around other fully vaccinated people, and there's this, there's a couple things, but then on down it says stay masked. And so I'm confused. If the vaccine is so effective, then why are we staying mask? Like, what's the discrepancy? Like, I get, around other people that have been fully vaccinated. And so back to the antibody dependency. So there is a question, because there are no published trials. The trial that I did find concerning some animal trials with some ferrets, I think, when the animals were released back into the wild and they contracted the disease, the ferrets died, and they said that it was due to an antibody dependency, and so the body, I guess the body just didn't shut off. Like, once we get all these T cells and things like that, and our white blood count, it comes up and it starts attacking, there was no shut off. And so that's the question that I asked on several platforms is, what about this? Has the answer to this antibody dependency issue, did it get answered with the trials, the clinical trials for, the vaccination?
So I will answer that with a caveat that, yeah, I'm a doctor. I'm a family doctor. I'm no expert in infectious disease. Okay, so I've studied this like you have, and what I would say is the vaccine's not perfect. Therefore, you get kind of the conflicting information about when do I have to wear a mask and when I don't wear a mask, right? My mom and dad are in their 80s, and they're not very healthy, and they got vaccinated, and I'm vaccinated, but we're still pretty careful when we're around each other. And I wear a mask in and out of the house, and usually I sit on the couch, 15 feet away from them, and I put my mask back on, and so do they before we hug, before I leave their place. As to the antibiotic dependency part of this, I don't think the full story is known yet. So that would be something that we're probably going to learn more about. The way that the studies work for how the Moderna and the Pfizer vaccine work to stimulate antibodies, and that's what you're talking about, these fancy T cells and these fancy B cells that are part of our body's natural immune system. At least what I know is for the people who've had the vaccination and even for the people who've had the illness, and if you get the illness, your body's going to have the same reaction. Obviously, the purpose of the vaccine is to hopefully get you ready that when you see the virus now, you're able to get control of it before it makes you too sick, but it doesn't work perfect. Right? So even the Pfizer and Moderna are only 90 or 95% effective. That's why you hear stories about people who've had their 2 vaccines and it's been 2 weeks, can still carry the virus. It's rare, can still get sick. That's very rare, and can still get hospitalized. That's very, very rare. But it's certainly not perfect, and I don't think that's a good one where there's still more research that needs to be done to answer that particular question. Theresa.
Thank you, Dr. Byrd. Which leads to this request. It says, can the panel address the historic concerns like the Tuskegee syphilis experiments, and why would there be distrust still today in the African-American community? So would any of you like to take that on and talk about the distrust with maybe the medical field and our historic?
I'll just start to say that we still are dealing with systemic racism, and that means our entire system from the time that we were brought to this country illegally for purposes that were horrible, that has carried till today. Now, I don't care what the verdict said today, we still have systemic racism. So that means everything from the churches that we love so much to medical to everything, it's in everything. So that's one of the reasons why there's distrust. It's not just distrust in healthcare. If you're African American and you know African Americans and you run with African Americans, you distrust a lot of things. But by the same token, we do a lot of things that we want to do. I really don't know who's making the Michael Jordan shoes that I'm wearing. That could be coming from a sweatshop over in China, but if I really want it, I buy it. So there are distrust, but a lot of times we do the things that we want to do. So I would say you do it like you do anything else. Yes, there are severe reasons to distrust. There are things that have been documented that we can go back and look at. But moving forward, we make decisions every single day with this distrust because we deal with this system daily, and we find a way to overcome and we find a way to rise. So I would say that you can't allow the distrust to stop you because it's never stopped us before. We've always navigated around it and found what worked best for us individually.
Anyone else want to tackle that?
I just want to say quickly, I am vaccinated as well, and I probably was one of the first ones up here to be vaccinated because of the nature of the field that I work in. So I had to say to myself along the lines of what Pastor Andre just said, yes, there is a lot of mistrust in the healthcare system when it comes to African Americans. But listen to me, what I had to reason with myself. If I get COVID, I'm at the mercy of the healthcare system. If I get the vaccination, I'm at the mercy of the healthcare system. There's one big difference. One, I walk in with a choice, and that's the vaccination. I make a choice for myself. I make a choice for my community. I make a choice for my family. And I have to do that in trusting something. For me, I just decided to trust God more than I was going to fear man. Because one thing that I did know, that at the time I got vaccinated, I watched a whole lot of people, including white people, get vaccinated at the same time. And one thing that I do believe is that this country wants to save lives. They do not want to be a country that has a body toll higher than any other nation because we lagged in getting vaccinated, or when help was there, that we distrusted everyone. So we got to start somewhere. And I think mobilizing Muncie, Dr. Byrd being here, the three largest healthcare entities working together to keep our community safe. Guys, this is a great start. If you are fearful, I understand it, because traditionally, a lot of bad things have happened in the healthcare system concerning African Americans. But we have something different. We know how to research. We know how to use discernment for ourselves. We know how to ask questions. We know how to press in. So we have to start taking care of ourselves. That's what tonight is about.
Thank you, Pastor Maria. I know our time is winding up, but there are a couple of questions that we've got to ask Dr. Byrd. One of them, if he can have a mic, or I could, how we want to do that. But one of them is, what research has been conducted on the vaccine in women of childbearing age?
That's a really common question, and I will tell you, I just think of things as I'm listening to the panel tonight. And when I think about fear of getting the vaccine, even in my organization, a healthcare organization, we also have fear of getting the vaccine. And the number one thing that I would hear when I was out rounding on my team was young female nurses not wanting to get the vaccine because there was fear of infertility. And what I can say is the research so far shows they've looked at women. Are they still ovulating? Are they able to get pregnant? Is there any more higher rate of miscarriage? All of that so far has not proven to be any problem at all. So in theory, and that someone talked about the internet and where there's information and where there's misinformation. Todd, I'm not sure if that was you, but I think that started on a not very credible source on the internet, and I feel very confident that the research so far is showing that there is no effect on women in their ability to get pregnant or to bear children.
Thank you. And then, Dr. Byrd, thoughts on how vaccine hesitancy can prolong the pandemic. So talk about what that hesitancy will do.
Yeah, that goes kind of back to that concept that I talked about herd immunity. You know, the more people we get vaccinated, the safer it's going to be for all of us, including our loved ones, right? So probably nationally, internationally, the best example might be Israel. Now, we all know Israel is a very homogeneous population and country. They got lots of vaccine early, and they had high public acceptance of the vaccination. And Israel now, I think 68% of their population is fully vaccinated, which is pretty incredible at this point in the country. And their hospitals are basically seeing no COVID, and from what I understand, it's basically business as usual. They still are careful about masks in public places and that, but that would be a good example of, you know, what we might be able to look forward to if we continue with great vaccination rates in the United States.
And so as we posted this information out for folks to join us on this platform today or virtually, I got a couple of inbox messages, and one of them was, what if I have already tested positive for COVID-19? Do I still need to take the vaccine?
Excellent question. I have 4 adult children. 2 of them got COVID. One of them was really pretty sick. The other just typical flu symptoms. And the studies show that it looks like that getting the vaccine, even if you've had COVID, probably protects you more than just simply the natural immunity from having had the COVID. So all of the experts strongly recommend wait at least 2 weeks from when your symptoms resolve, and once your symptoms resolve, go get yourself a COVID vaccination. Absolutely.
And then one
Now,
more.
now
go
may
ahead.
I say that there is some emerging resource. So if you have had it, in full disclosure, it hasn't been proven yet, but the first vaccination, if you've had a symptomatic case of COVID, many times the little side effects are a little bit worse. So know that going in.
If I've been vaccinated, will my protection will it protect me from other variants of COVID that are coming on the scene?
Yeah, another perfect question. So far, every variant known to mankind from the COVID is still completely susceptible to the current vaccines. So that's good.
Thank you. And then a question for Pastor Maria that we received. It says, where can I go if I do not have a device or internet access to register? If I can't register online, how can I get vaccinated and where? And I'll
Okay,
turn it.
good question. If you could bring up the slide, please. So this is what we were going to actually end with.
Sorry.
The open door has Moderna. As we know, J&J is currently paused for all healthcare facilities right now. And so we will keep this slide up. And if you could go to the next one. If we have said anything here today that that you've had a change of heart about the vaccine, we want you to know that you can come to a safe environment, and that is here at Urban Light tomorrow from 12 until 5, so noon until 5, and we will have a meal here. And so this will be the Moderna 2 shot, so you would have to come back once again. So Meridian will be here with us tomorrow. But also, as Dr. Bird had said, you can call 211. You can actually visit their website. So we have Open Door. We have IU Ball Hospital. We have Meridian. All are giving the vaccine, as well as various pharmacies, right? And so if you do not have internet reception or a device, please contact me here at the church. I will make sure, trust me, I will make sure that you get connected where if you want to be vaccinated, you can. That is my word to you.
Thank you. So final thoughts. So I'll give each of our panelists 30 seconds to give their final thought, and I'll say thank you in advance. So we'll start with Todd. You have a mic.
I don't want to have to tell anybody what they should or should not do. I just say look at it from the point of who do you love? Do you want to see them? Do you want them to feel safe, or do you want them to be safe? That's why I did it. I don't think you're being selfish if you don't get it, but I wanted to be selfless and say, hey, I see a lot of people. I'm a very social person, so I think the best thing for me to do was to get the shot.
Thank you.
Mm-hmm.
Theresa Long.
Like Todd said, I would never tell someone to get the shot or not to get the shot. It is your personal decision. For me right now, it's so many questions, questions. The VAERS reporting site, less than 1% report adverse reactions to the vaccination. A lot of things that Dr. Fauci, I watched these things carefully, not just some conspiracy theorists. I'm listening to the experts. I'm listening to immunologists and epidemiologists and, from everywhere, not just from one side, because there are a group of professionals who advocate against this, and we never get to hear that side. And so I'm grateful even to be here tonight, to be able, to voice this, because, all in Muncie, I've been saying, like, why is there not another side? Like, why is it one narrative? It's just one-sided. And I think for people to be able to make an informed decision, we need to have experts on both sides. So,
Thank
yeah,
you.
that's it.
Thank you. Dr. Elliott.
I just want to say, like these two have already said, you know, I can't tell you to get it or not get it. I want you to do your research, pray about it, and do what's best for you and your family.
Thank you. Councilwoman Davis?
Again, I'm going to reiterate what everyone has said so far. I can't tell you what to do, but I will add this. Everything is new once. There's always something new that it's new to our environment, it's new to our systems, it's new. So until we try it out, we don't know. But, you know, I have faith that we're going to be okay. And so make your decisions, but just remember, smallpox killed thousands of millions of people at one time. Not sure the numbers, but they did. But they took the vaccine, and I don't see it anymore. So it's something to consider.
Thank you, and bring it home for us, Pastor Andre Mitchell.
I agree with everyone else, and I would like to add this word bully. Don't let anyone bully you into a decision that you don't want to do, either or. Make your own informed decision. And then if you make a decision and you feel a certain way, then you can open your mouth and speak. So like I said, I made my decision, and because of how it's gone for me so far and my wife, I feel comfortable telling other people that it's okay to take it, but I will not bully anyone into any position.
And so again, we want to say thank you all for tuning in. We want to thank Dr. Byrd for being here. We want to thank our panelists for being vulnerable and honest and open about their experiences. I also want to thank Pastor Draper and Pastor Maria with Urban Light and opening up your house for us to be here. And again, you've heard all of us share our stories. And again, know that you can reach out to Maria Wilson, Pastor Maria Wilson here at Urban Light to get assistance with being vaccinated or even additional questions. And if you find yourself connected to anyone that's sitting here, you know that you can find us via social media, or you know us from the community. So I'm sure that most of us would be willing to have a conversation with you and walk you through whatever it is. And so I thank you again. I'll turn it over to Pastor Maria for final remarks, and you all be well.
I want to thank everyone who joined us tonight. I thank everybody on the panel, Dr. Byrd, Pastor Draper, all of you who are out there listening. We are in this together. Just even mere fact that we're here tonight in this platform being honest. And I just want to leave you with this. We didn't get to talk about some things like the Tuskegee experiment and Henrietta Lacks and things of that nature. Know that all of us here, we took that into consideration as well. But we are living testimonies that I got my vaccine. I was fully vaccinated in the second week of January, and I'm here, I'm well. So I hope that you make a good, informed decision based on facts, not on fear, not on what you think, and not certainly what anybody else tells you. Get the information for yourself, and we are here for you, and we love you. Be safe. Thank you.